Assalamu alaikum viewers, Dr. Irfan Mughal here. Today we will discuss about basic life support. Whenever a patient is in cardiac arrest and you have to save his life. There are two types of cardiac arrest: in-hospital cardiac arrest and out-of-hospital cardiac arrest. So there is a chain to manage this type of cardiac arrest through 6 links, which we will discuss here. Prevention and preparation of cardiac arrest, then activate the emergency response system, do high quality CPR, advance resuscitation, post cardiac arrest care, and recovery phase. Whenever you see a collapsed person there, you have to follow following steps. First, verify scene safety. Second, check for responsiveness. Third, then you have to shout for help and activate emergency response system and ask for AED. Fourth, you have to check for carotid pulse by locating the trachea using 2 or 3 fingers. Slide finger into groove between the trachea and the muscle at the side of neck. Feel the pulse for at least 5 but no more than 10 seconds. If you don't feel any pulse, you have to start CPR. For CPR, you have to remember the mnemonics CAB, C for compression, A for airway, and B for breathing. So first start with compression. After you start compression, you have to open the airway and give breath. For breath, you can use pocket mask or a face shield, and also can be used bag mask device. Remember that this is the basic life support of children, and it is started from 1 year to puberty. How will you check the puberty? Chest and underarm hair in boys and breast development in girls. So for a good CPR, you can use 1 or 2 hands. Now here is the question: when you will say that CPR is effective or compression that you are giving are effective? When 1/3 of the child chest is compressed, it means the depth of compression must be 2 inches or 5 centimeters, and the chest must recoil completely in between the compressions. You must place the child on firm and flat surface and remove the clothes if possible. Now we will discuss what is the technique of a good compression. You must place heel of the hand on the center of the chest. You can say that on the lower half of the sternum, and heel of the other hand on top of the first. Your shoulder should be directly over hands, and you must have your elbows straightened. Push hard and fast. The frequency of compression must be 100 to 120 compressions per minute and must give proper and effective breaths. If there is one rescuer, then the ratio of compression to ventilation must be 30:2. And if you are 2 rescuers, the CPR must have the ratio of compression to ventilation 15:2. To open the airway, you must use the maneuver, the head tilt maneuver and the chin lift maneuver to properly open the airway. And if you are using the bag mask device, you must use the technique which is known as E and C technique. After that, you must see the chest rise to be sure that you are giving the breaths properly. If the chest is not rising, and then you have to change your position for opening the airway. That's all from today, and thanks for watching.